I want to say thank you for the opportunity to chat with you today, and thank you for all the work you do in your communities to make them healthier.
So throughout this presentation, we are going to go over a few basic parts of what makes Show Me Echo so great and highlight how your organization can benefit from utilizing this free resource. Before we really get into Echo, we wanted to review the current state of Missouri health rankings. Unfortunately, Missouri is not performing well in healthcare outcomes compared to other states. In fact, on some measures, we're performing near the bottom. We're 42nd for health outcomes, 37 for access to care, 36 for mortality rates, and 42nd for healthy behaviors. We have a lot of challenges to overcome in order to improve health outcomes, particularly with rural communities and medically underserved populations. That's where Show Me Echo can help. If you work in a rural community, you already know how hard it is. And you know that hospital closures in Missouri have increased exponentially in the past several years. Right now, there are 55 rural counties without a hospital. That just means that there is a far greater need for those that have hospitals to provide exceptional care to the surrounding counties and communities. Show Me Echo might be a resource that empowers you to better meet the challenges and address these needs in your community. Right now, Missouri has 114 counties and the city of St. Louis, so you can see that about half of the state lacks access to a hospital close to home. Show Me Echo helps to bridge that gap. Show Me Echo benefits everyone, whether you live in a rural or urban community. However, we know that folks residing in rural settings have lower health outcomes than those in urban settings, and that's where Show Me Echo can make a true impact. By extending specialty and expert knowledge to those rural providers, we're able to help bridge the gap with these disparities. Not to mention, our echoes, which we now have over 30 topics, address specifically all of these leading causes of death in Missouri. Clearly, we have some work to do to improve the health outcomes in our state. But we believe that Show Me Echo and telehealth are a part of this solution. And we hope that Show Me Echo will be a valuable resource that you can use in your clinic to help with these challenges and improve your overall health outcomes in your community. So what is ECHO? ECHO stands for Extension for Community Healthcare Outcomes. It's an educational platform that uses Zoom and technology to create a community of learning that's focused on extending specialist and expert care to other practitioners across the state. It's a way to share expertise with providers so that they can give their patients improved care in their own communities. Patients don't have to travel far and spend money outside of their home community, and they can receive exceptional care from a provider that they know and trust. This is often referred to as an all-teach, all-learn philosophy. This means that the learning collaborative can move knowledge, not people.
I like to try to use a story and kind of how ECHO came about to also give you an idea of how the ECHO program works, and the way that it multiplies healthcare access in communities for the folks that we serve. One of the folks that established the ECHO program was Dr. Sanjeev Arora. Back in the 1990s, he was one of only 2 clinicians in the state of New Mexico that were treating folks with Hep C. And back then, the procedure to treat Hep C was kind of long and a little involved and not particularly easy. And so with only 2 people treating, the wait time was almost 18 months. And so he was telling us the story of that there was a young woman with 2 kids who, by the time she finally got in to get the care that she needed, the disease had progressed to the point where there really wasn't anything he could do for her, and she wound up dying, leaving 2 kids behind. And he felt that the healthcare system had really failed this young woman. And so what he did, he reached out and he recruited 15 general practitioners and asked them if he could teach them in a couple sessions how to treat folks with Hep C. So he wound up teaching 15 more folks how to treat Hep C. So then from going from 2 to 17 folks, the wait time went down to 2 months. He did this a couple of more times until, guess what? The wait time went down to 2 weeks. And it's probably not a big surprise that the folks then were having better healthcare outcomes. Even though they weren't being treated by a specialist per se, they were still getting the specialist care from their generalist in their hometown communities in a more timely fashion, and they were having better healthcare outcomes. So in this diagram, you can see like the difference between telemedicine and the ECHO program. when you typically think of telehealth, you probably think of connecting a physician with a patient over a distance, and that is traditionally how we've thought of telehealth or telemedicine. But with the ECHO program, what we do is we connect healthcare providers together with their peers so that they can talk with each other about challenging cases, learn from each other, and push out better healthcare. What this does, it helps share the information from these specialists to generalists so that generalists can get this specialized care out to communities where it's not easily available. And it kind of multiplies that information and makes us able to increase the capacity. And so we can serve more folks in our communities with specialized care.
Part of what makes ECHO so successful is the ECHO hub and spoke model. Essentially, this helps to keep up with the all teach, all learn philosophy. There's more interactive components, there's guided practice, ongoing mentorship, and peer-to-peer learning so that they can be collaborative in how they're problem solving. This starts with our hub team. They are the center of how each ECHO starts. This is our team of experts and specialists from across the state. They share their expert and specialist knowledge to other participants. These are our spokes. These are healthcare professionals from multidisciplinary groups from all over the state that attend the ECHO sessions and learn from the specialists. And then those spokes take that information that they have learned and share it with their organizations, with their colleagues, or even just with their patients. And that's how we're able to expand the reach through this model. So here's a little bit more about how an ECHO session works. There are 3 main components to each ECHO session. They start off with a hub didactic, which is another fancy word for a learning burst, a knowledge burst, a quick lesson about something that's related to the topic of the ECHO. The second part of the session is a case presentation, and this is really the heart of ECHO. This is when individuals bring their cases from real life experiences and challenges in their personal practice or organization that they can share with the rest of the group to offer resources, give suggestions, and make recommendations. We often call people that present those cases our heroes because without those cases, we don't get to have such rich learning. And finally, after that case presentation, the entire group, both the hub team member specialists and the peers of other participants on the ECHO, will offer recommendations. Those notes will be taken and shared to everyone so everyone can learn from those suggestions.
So there's lots of benefits for participating in ECHO sessions. And rather than read you some of the benefits off a slide, I think I'd rather share a story of the success and how it creates these win-win-win situations. So I sit in on a lot of ECHOs. I hear a lot of these stories, and this was one in our autism ECHO. And someone brought a case to the table, and it was a young boy who was nonverbal. He really would only eat specific foods, so he had this very rigid, self-regulated diet. And he had emotional meltdowns almost daily that were so traumatic that really the family kind of hated to travel in public because when he had these meltdowns, people would kind of look at them strange, like, what are you doing to your kids to make them act this way? So it was really kind of affecting the quality of health for the entire family. They had been trying to treat this kid through their local clinician for over a year and really hadn't gotten anywhere with behavior modification. And the attending physician was about ready to give up and thought, rather than refer him up the road right now, I'm going to attend an autism ECHO and see if they have any advice. So he attended the ECHO and he presented the case, and then how it works, everybody gave their input. Once everyone had a chance to give their input, then it was the hub team's turn to give their input on how this case might best be served. And Dr. Soul from the Thompson Center said, have you done a DNA analysis on this kiddo yet? And they said that they had not. So she recommended doing a DNA analysis and revisiting the case. Well, once they ran the analysis and revisited the case, it was found that this kiddo had a micro deletion on a particular chromosome that created a syndrome very similar to Prader-Willi syndrome, but also tended to respond well to a particular drug. So they recommended putting this kid on a particular drug. They get the kiddo on this drug, and guess what? They start seeing a whole new kid. Now he's becoming verbal. He is eating more foods, and his meltdowns have decreased significantly. So the family's happy because they don't have to travel 100 miles up the road to get the care they need. The clinic's happy because they can keep this kiddo in-house and don't have to refer away their patients. But best of all, the kid has better healthcare outcomes and higher quality of life. So that's kind of shows how this information sharing really helps serve the members of our community and helps keep care local and helps promote better healthcare outcomes through earlier and better diagnosis and then better treatment and care. We believe, for example, that just our Hep C echo alone has cured over 300 people of Hep C and identified over 100 cases of melanoma. We believe that our asthma echo has saved the state about $28 million. And you're like, how did we do that? Well, about 60% of the folks with asthma who show up in emergency rooms unable to breathe are on Medicaid. And when we do a better job of providing health care around folks with asthma and drive those numbers down, it winds up saving Medicaid dollars. And but above that, these are all these folks who aren't showing up in emergency rooms unable to breathe are having better healthcare outcomes. So these are some of the things we've been able to accomplish. We also, it's reported by attendees that about 94% of those folks who attend our echoes believe it's changed the way they practice.
Show Me Echo has over 30 different echo topics. In a previous slide, you saw that we listed the top 10 leading causes of death in our state. With so many echo subjects to learn and discuss, we know that we can help address those disparities. Not only do we offer adult, clinical, and behavioral health echoes, we also offer pediatric and child clinical and behavioral health echoes, as well as education and community and wellness. If there is a need in your community, we have an echo for you.
This slide is a dashboard shot of MoHealthNet's statistics on Hep C in the state of Missouri. And as you can see, with Medicaid expansion, we're being able to test more and more people for Hep C, and we're finding more and more cases of Hep C in the state. Currently, we have over 28,000 cases of Hep C identified in the state, and only 27% of the state tested. So that number could increase dramatically. We really need to increase the capacity to treat these folks, and attending the Hep C Echo is one way to do that. Folks who attend the Hep C Echo get mentoring on how to treat Hep C, and together we can stamp out this disease in the state of Missouri.
Show Me Echo is also working to address the maternal mortality rates in our state. As many of you know, Missouri is one of the worst states for maternal mortality, ranking 44th. 84% of pregnancy-related deaths have been determined to be preventable. Women on Medicaid in the state of Missouri are 10 times more likely to die within 1 year of pregnancy than those with private insurance. And perhaps most alarmingly, Black mothers in Missouri are 3 times more likely to die within a year of pregnancy than white mothers. Missouri's challenges are exacerbated by limited access to healthcare services, and Show Me Echo wants to help. Governor Parsons recently announced that the Missouri Department of Health and Senior Services would be providing new funding to improve the health of pregnant women and support their care after childbirth to help with these maternal mortality and poor health outcomes. Show Me Echo is a way to extend the knowledge and best practices to all those rural areas that need more support so that we can help decrease the numbers of moms and babies who are suffering and dying. What do you do now? Well, the first thing you need to do is register. We have this cool QR code that you can scan right now on your phone and register for the next Echo session. You could also visit showmeecho.org to learn more about our different programs and to find more information about registration.
And again, our echoes are free, and you get free CEUs for participation. And it's really a great way to stay connected with a community of learners that are really passionate about providing the best healthcare they can to the patients they serve.
If you have any questions, please feel free to reach out to us. Otherwise, we'll see you on the next Echo.
And thank you so much for participating.